Well, hello, teacher and classmates. I'm going to expose you the final exam. Okay. The next one is this. Well, I'm going to expose about the injections. So, first of all, we have to know which types we have. So, it is essential to know the types of drug administration routes that exist. Among them, the main one is the oral one. However, there is also the parental, and these are the injectables. The administration by injection or the parental administration includes the following routes. That is the subcutaneous, under the skin, intramuscular, in the muscles, intravenous in a vein, and intrathecal around the spinal cord. Okay, a drug product can be prepared or manufactured in ways that prolong drug absorption. On the injection site, for hours, days, or longer, such the products do not need to be administered as often as drug products with more rapid absorption. We're going to focus on the parenteral route, which is the most applied in pharmacy area. The intramuscular route is preferred than the subcutaneous when there are larger volumes of drug product and needed because the muscles is below in the skin and the fatty tissues as longer the needle is used. So the drugs is usually knit into the muscle, the upper arm, thigh, or the buttock. That is like the most frequent area. So and these have like such like benefits. So how quickly the drug is absorbed into the bloodstream depends on the part of the blood that the muscle are. Okay, later we have different areas to apply. In the first one, we have like the deltoid muscle of the arm, and this one is the one that we have here. Later, we have the vastus lateralis, and the most frequent one is the gluteal area. This, we have to apply the injection with an angle of 90 degrees and upper the quadrant, the left one or the right one of each respective area. Okay, we have an important aspect that is the room. An injectable room is necessary. The most preferred one is the sterile room. We have to have like all the things that we can need, like with the medications, the preparation table, or the place that you have to wash your hands. And with the steps, the first one is the wash of your hands with soap and warm water to prevent potential infection. The Center of Disease Control and Prevention trust that recommends the part of lathering for 20 seconds, which is like the time it takes to sing Happy Birthday song. Later, we have gather all the needed supplies. It have to be like the alcohol pads, the needle, the gauze, the bandage, and like all the things that you're going to need. Later, we have to locate the injection site to isolate the muscle and the target that we're going to place the injection and spread the skin and the injection site with between the two fingers. Okay, later we have to clean it and the part of the injection site with an alcohol swab along the skin, and we have to load to dry. Later we have to prepare the string with the medication. In this part we have other part of steps. The first one is the part to remove the cap of the needle or the cap of like the vial. It depends, it is if a pen or it is a multi-dose. So we have to take note about when the vial is first opened, and the rubber stopper should be cleaned with an alcohol swab. Later, we have to draw some air into the string. So this part helps like to the liquid to get into the string. And we have to insert into the vial, remove the cap from the needle, and push the needle through the rubber. We have to be careful to not touch the needle to keep it clean. And later we have to withdraw the medication, turn the vial and the string upside down, and the needle points upward. And the last step, and one of the most important, is remove the air bubbles. We have to tap the string and push the any bubbles to the top, and gently depress the part of the plunger to push the air bubbles out. We make it like we can with our fingers. We only have to be gently. Later, we have the part to inject the medication. We push the plunger slowly to inject the medication into the muscle. Later, we wait a few seconds, like 10 or 20, it depends of the type of medication. We remove the needle, withdraw the needle quickly, and discard into the puncture-resistant sharps container. It depends, like there are people that prefer to put the cap back on the needle, but we have like to be carefully with that because you can touch it and that could be infection. The sharps container, it is usually in a red container that you can purchase in any pharmacy, and it usually collect like the medical waste, like needles, the strings, and all the material that could be like contaminated. Later, we have like the part two, apply pressure to the injection site. And we can use like a piece of gauze to apply like a little pressure, and you can even like massage the area. So, and that's it. Thank you.